Welcome to the Wellington Training Academy, licensed and authorized by the American Red Cross. My name is Amy and I'll be your guide. Emergencies can happen anytime, anywhere. EMS professionals and healthcare providers are prepared to give the best medical care, but they're not the first ones to respond. You are. You must take the critical first steps in giving care until help arrives. The purpose of the first aid, CPR, and AED program is to give you the confidence, knowledge, and skills to recognize a life-threatening emergency and give immediate care. So, when minutes matter, you'll be prepared to be the best first responder. Upon successful course completion, you will receive a certificate from the American Red Cross. It is important to prepare for emergencies. Ensure you know where a first aid kit, bleeding control kit, AED, and medications such as an epinephrine auto-injector, naloxone, aspirin, and an asthma inhaler are kept in your workplace and at home. Also, ensure that emergency action plans are in place, including having a family plan. Once you have recognized that an emergency exists and have decided to take action, you should follow the emergency action steps. Check, call, care. In the following scenario, you hear a loud crash and turn to see your co-worker, McKenna, lying on the ground next to a ladder. What is the first thing you check? Check the scene for safety. The scene is safe. What do you check next? You should check the person by forming an initial impression. Remember, the initial impression is a quick scan as you approach the person to give you an idea of what's going on with them. Scenario 1, McKenna appears unresponsive. Consent is implied. What do you check next? You should check for responsiveness using the shout, tap, shout sequence. Check for breathing, life-threatening bleeding, and other life-threatening conditions. Scenario 2, McKenna responds but is not fully awake. You notice a large lump on her head and suspect a severe head injury, which is a life-threatening condition. What do you do next? You should stop the check step and immediately move to the call step. While waiting for EMS, give care according to your level of training and continue your check to determine if additional care is needed. You see your co-worker Porter clutching his arm and wincing in pain. The scene is safe. As you approach Porter, you do not notice any life-threatening conditions. You obtain consent. What do you do next? You should continue your check as appropriate to determine if additional care is needed. Interview Porter using SAM. This is an acronym for symptoms, allergies, and medications you're taking or medical conditions. You should conduct a focused check. You have determined that your co-worker, Evan, is experiencing a life-threatening emergency and you need to call for help. What does the call step include? This includes calling 911 or the designated emergency number. Get equipment such as an AED, first aid kit, or bleeding control kit. You ask your co-worker Jaden to make the call. How should you communicate with Jaden to ensure the call is made and help is on the way? Always pick someone specific. Make sure they come back and tell you the call has been made. Look directly at them and say, Jaden, call 911. Evan requires care for a life-threatening condition. What are general guidelines for anyone requiring care? Guidelines are: give care consistent with your knowledge and training. Offer to assist the person with medication administration if needed. Help the person rest in the most comfortable position. Keep the person from getting chilled or overheated. Reassure the person by telling them that you will help and that EMS personnel has been called if appropriate. Continue to watch for changes in the person's condition, including breathing and level of responsiveness. Now, let's take a look at putting a victim in a recovery position.